The Centers for Disease Control and Prevention, the CDC, estimates autism's occurrence as 1 in 68 children in the United States. It is more common in boys, with them being diagnosed 1 in 42 and 1 in 189 girls. Autism is a complex developmental disability. It's the result of a neurological disorder that has an effect on normal brain function, affecting the development of the person's communication and social interaction skills. Autism typically presents itself in the first 3 years of a child's life. Autism is a range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication, as well as by unique strengths and differences. Children are typically diagnosed between 2 and 3 years old, sometimes as early as 18 months. According to the CDC, the ways children are diagnosed are by developmental screening, which is a short test to tell if children are learning basic skills when they should, or if they might have delays. The second step of diagnosis is a comprehensive evaluation. The thorough review may include looking at the child's behavior and development and interviewing the parents. It may also include a hearing and vision screening, genetic testing, neurological testing, and other medical testing. In order to make sure a child is diagnosed early is to look out for certain signs and symptoms. Autism states that some of the signs and symptoms are communication difficulties, social challenges, repetitive behaviors, and sensory processing problems. Communication difficulties differ with each autistic person, as no two are exactly alike. People with autism are usually have delayed language milestones, and many may not speak much or even at all. They also have a hard time reading emotions of others, which can be a barrier. They have a hard time reading body language, tone, and facial expressions, and likewise have a hard time showing the proper body language and facial expressions they truly mean. Children are typically social, yet autistic children tend to not respond in the same way. They usually are delayed in responding to their name and wanting to interact with other people. They typically like to play alone. Research shows that autistic children, even though it may not look like it, are really attached to their parents. The parents say the children seem disconnected, but it is just that they do not interpret what others are thinking and feeling properly. Autistic people also like repetitive behaviors. They like predictability. Routine is what they crave and feel comfortable with. For a person with autism, change can make them feel completely put off and upset. Therefore, having a daily routine to follow is very beneficial. Sensory processing is also a problem for someone with autism. They have difficulty processing and integrating sensory information such as sight, sound, and smell. They may process it as painful or unpleasant, even if it is normally not. Some may be hypersensitive and some may be hyposensitive. This means some respond in defense and some do not respond at all to the stimuli. Looking out for these major things can be key for early detection of autism, and that way they can begin early treatment to help. There is no cure for autism, but there are some intervention and therapies that can be helpful. Pivotal response training aims to increase a child's motivation to learn, monitor behavior, and initiate communication with others. Verbal behavior intervention focuses on teaching verbal skills, and sensory integration therapy helps a person deal with sensory information, such as light, sounds, and touch. And speech therapy helps to improve a person's communication skills and learn how to verbally communicate better. Autism is not a curable disease, but with early detection, the right treatment can be given to help a person live as normally a life as possible. Having communication, sensory, and social challenges can be frustrating and hard, but they can be improved. It's also important to remember that no two autistic people are the same, so they never should be treated as so. Proper diagnosis and treatment is key. My visual that I wanted to show is the signs of autism, and this just shows kind of what I went over, like inappropriate playing with toys, inability to relate to others, the hyperactivity or hypoactivity, oversensitive or undersensitive to sound, and they also lack of awareness of danger. Thank you.